Good, thanks. How are you?
There she is. Because I know I haven't figured out how to talk with this thing off. Touching everything. Right. I have to take this off. I'm still burning. Well, good afternoon. Thank you all so much for being here. I just wanted to start this week with a general update in terms of where we are. And you'll hear from Dr. Jennifer Bagno, our Director of Health, as well as Director Colin Arnold of Homeland Security. Now, we're well over 6,000 cases, and we're right at 339 deaths, as you know, and we are staying on a path. We were very excited about 12 days of the positives, kind of fewer and fewer as we go, but we are, of course, managing the data, requesting even more data sets from the state so that we can be as accurate as possible every step of the way. We are doing what it takes to ensure that our people survive, and not only that, thrive as it relates to us coming out of this crisis and moving from crises to recovery. And that means staying safe now and making decisions for the future based on science, on data, and on our analysis, listening to our experts. We've always done that, and we will continue to do so. And last week, listening, I was on a mayor's call, and it was very clear that the data will drive us and not a specific date. And I've adopted that, and I'm going to remain focused just on that, on the data and not the date. It would be staggeringly irresponsible to set an arbitrary date to pretend we can flick a little switch and bring businesses back immediately online throughout the city of New Orleans. Again, we're going to be guided by data and not a date. And we're going to continue to fight at every step of the way to ensure that our people get their fair share of our federal relief dollars that we know we so desperately need. We have been in collaboration with our partners on the local, state, and federal level since we began. Working, of course, with the New Orleans City Council, who have been extremely supportive and engaged throughout this process. Standing side by side with my fellow parish presidents and working every day with our state public health officials and, of course, our governor. Working continuously with our congressional delegation to advocate for the needs of the citizens of New Orleans. And at every level, leadership matters. And so to the citizens of the city of New Orleans, please know that I will and have always continued to put the health of our people first. They are the top priority. And I will always tell you straight. And not only that, you can be reassured that I will not be bullied in making decisions that are the best, in the best interest of the citizens of the city of New Orleans. I will continue to foster collaborations with stakeholders in New Orleans and throughout the region, as I have demonstrated over and over and over again. That is not in isolation, meaning of this COVID event. I established a committee structure within days of our first case, if that matters, as it relates to reporting back with community stakeholders and, of course, engaging stakeholders every step of the way. Over 13 committees have been working nonstop as it relates to managing this crisis. I'm on multiple calls weekly with industry and community leaders. I'm in routine communication, again, with mayors and parish leaders. regionally, and not only that, across the United States of America. But as we speak, my administration is working with the New Orleans Business Alliance, that is the city's arm, as well as with our partners with the New Orleans Business Council. We're putting together a committee structure that focuses on reopening the city of New Orleans. This is something that we have started to focus on and pivoting several weeks ago. But with this, it is my hope to have more details and unveiling what that committee is and will be and the structure that we will follow. But it will be multifaceted. It will make sure that we are inclusive of not only all of our business stakeholders, but the community as well. But while I will, and I tell you this, I always appreciate feedback from stakeholders, from business leaders, from community leaders, you name it. I'm always accessible, continuing to check my own email, always. And not only that, I understand that I do not need any permission from anyone in terms of doing my job. And I'm going to do my job to the best of my ability, again, as I've demonstrated. The people of New Orleans gave me their permission when they elected me mayor of the city of New Orleans, coming on 2 years now. May 7th, that will be that milestone. We cannot fall into any false narratives. I have to say that again. We cannot fall into any false narratives when it comes to the public health of our citizens. And there is, I'm telling you, no economy without public health, hand in hand. And that will be our approach as we've been consistent in that regard. So with that, I'm going to have Dr. Begno bring you more information about where we are, the mobile testing that we are implementing, as we reported to you last week, that we will start to go deeper into neighborhoods, areas that we have identified as some hot spots throughout our city, so that again, we're meeting people where they are, we're going to them, not only for testing, but also for thorough case management. It's very important. So with that, I'm going to turn it over to Dr. Begno. Of course, I'll be right back, and we'll weave in Colin, and then I'll come back for questions and answers. Thank you. Dr. Begno.
Thank you, everybody. Thank you, Mayor. We continue to be encouraged by the fact that our new daily cases have been consistently dropping for at least the last 10 days on average. That's a really positive sign. That means our stay-at-home order is working and fewer people are getting sick. I want to remind you that some of the models, the original projections for Orleans Parish anticipated over 1,300 deaths from COVID-19 in the first period. We believe that because of everything that you've done, staying home these last few weeks, we will be able to cut the number of deaths at least in half and probably more. But even then, it is really important to emphasize that COVID-19 in the past few weeks has become our leading cause of death in New Orleans. And this is a disease that we had our first case 6 weeks ago. That is a tremendous burden. We will continue to see deaths, unfortunately, as we progress through this. So while we are cautiously optimistic about fewer new cases, it is definitely not the time to let up at all. When you are in the middle of a battle, do not put down your guns. And if there's anybody in the city of New Orleans that doesn't know someone who's been touched by deaths of COVID-19, I would like to meet them, because this is personal. It is intensely personal for all of us. Nola Reddy is going to be putting out, and the city will be putting out on social media, a series of videos that we've done with the mayor and with some of our staff and our community members who either have been personally affected or who have lost loved ones. And I ask you all to really look at those and see the emotion when they talk about this disease. And think about that when you're thinking about the inconvenience of maybe staying home a little bit longer. So I encourage you guys to look at that. As we said for the last few weeks, we are very proud of the amount of COVID-19 testing we've done in New Orleans, far more per capita than almost anywhere in the world. And as we cautiously look to this next phase, we must ensure that we are maintaining a high level of testing. This is an absolute criteria for any reopening, re-entry process across the nation. Our drive-through testing program, in cooperation with Jefferson Parish, was able to reach over 15,000 residents in the region and counting. But we know that it's critically important to ensure that access to testing, diagnosis, and other support should not be dependent on where you live or if you have a vehicle. We also know that this disease is disproportionately affecting and killing our African American members and residents. That's why in the coming weeks, starting tomorrow, we are bringing testing to key neighborhoods throughout the city. Starting tomorrow through Friday of this week, walk-up testing will be available at Xavier University from 8 a.m. to 4 p.m. until we've reached our maximum of 250 daily tests. If you are over 18 and you have any symptom history or any exposure concerns with a close contact, come and get tested. Results will be available within 2 to 3 days. This is a lot faster than we were able to offer in our drive-through testing. I am especially encouraging our neighboring residents in Gertown and Holly Grove and those neighborhoods that border Xavier, please come and get tested. We want to see you. We plan to be in a different neighborhood each week, and as the mayor said, we will be providing more than just a test. We will have a resource center there with additional resources so we can address your needs immediately and make sure you have what you need to get through this. I am incredibly grateful to our partners at LCMC Health and LSU Health Sciences who are working with us and are making this mobile testing program possible. I don't know that there's anything quite like it in the rest of the country. More information about the program is available at ready.nola.gov/mobile-testing. Thank you.
Thank you, Dr. Abegno. And one of the things that Dr. Abegno mentioned were when she talked about the amount of deaths, it made me think about when you look at the obituary section in the newspaper now, take note of how many pages. Page after page after page after page. And so it's personal. So with that, we'll have our Director of Homeland Security, Colin Arnold, provide an update as well.
Everybody. New Orleans Office of Homeland Security and Emergency Preparedness continues to manage our centralized logistics warehouse at the Smith King Center. We're handling a large quantity of supplies, supporting a regional response to COVID-19. And I wanted to take the time to really thank the residents of New Orleans and our partners for generous donations that have been made to help save lives. We've received thousands of items from you, our residents, during the week-long PPE drive we did. Those supplies have been dispersed among our public safety agencies and to other personnel who continue to work on the front lines of this disaster. We also received generous supply donations from Lowe's, AmeriCares, the Greater New Orleans Foundation, Global Empowerment Mission, Matthew 25 Ministries, Frontline Support, and the New Orleans Chinese Association. We're grateful to all of these groups for what they've done. In that vein, I'm excited to announce a new donation today from Hanes. They were able to basically shut down their assembly lines and repurpose 100% cotton and make washable and reusable face masks. And they've given 157,000 in New Orleans. Looks rather familiar. It's from Hanes. We're going to make them available. Hanes donated them, wanting them to get out to the population of the parish. So we're going to make them available to essential businesses like grocery stores, banks, and hardware stores through sodat.com. And and we'll also be giving them out to residents at the various food and supply pantries around town and at the mobile testing sites. With this donation, we are now making the strongest possible recommendation. When you do essential activities like grocery shopping or going to an essential job, wear a face covering. It's especially important for essential workers like grocery or pharmacy clerks to wear face coverings, as they are coming into contact with many people throughout the day. You don't have to wear a face covering during outdoor recreation, but you should stay 6 feet away from others. A face covering can be a cloth mask, a bandana, a scarf, or even a t-shirt. At this time, you should not be purchasing medical grade masks, which are in short supply. It's critical that surgical masks and N95s are reserved for those who need them the most and have the highest risk of infection, that is healthcare workers and first responders. I'd like to switch gears and talk about another topic that's very important this time of year, hurricane season. We're just 6 weeks away from June 1st, the beginning of hurricane season. This year's season is predicted to be above average, with 16 storms in general and potentially 4 major storms landfalling in the United States. It's important now, more than ever, to have your preparations in place should a storm come our way. While you're staying at home, take the time to evaluate your evacuation plan and gather supplies to shelter in place for a lower level storm and supplies that you need in case we need to evacuate. Get flood insurance for your building and your contents. Remember, it takes 30 days for a new flood insurance policy to go into effect. Pay attention throughout hurricane season. More than ever, pay attention. And if we ask you to do something, please heed our warnings. The question has come up, and of course, COVID-19, the pandemic, will certainly complicate our existing hurricane plans. We continue to work with our state and federal partners to make contingency plans to account for COVID-19 in an evacuation or sheltering scenario. These conversations are ongoing. What I will say is that the entire Gulf region will be facing significant challenges this hurricane season, given the ongoing need for social distancing. But I'm confident that here in New Orleans, we're nothing if we're not creative and resilient. We will get through this together. Thank you.
Thank you, Colin. And as we have been communicating, but you will hear more on this like almost weekly, or if not daily, as it relates to hurricane season. It starts June the 1st, and that's just another thing that we have to prepare for in the midst of COVID-19. We have been laser focused on this, and even as it relates to a high river. Mississippi River is at its highest peak. As it was last year, it hadn't been that high in 200 years. So we are being very comprehensive in our approach, and we will continue to be. And I want everyone to be encouraged that while, look, we're making significant gains in the city of New Orleans, moving towards a healthier community, but we are not there yet. And what we're doing and what we're continuing to ask you to do to stay at home is getting us where we need to be, healthier, but even being able to think about and pivot towards a recovery for the city of New Orleans. So you do your part, and that will get us closer to being able to open up our city to where it's a benefit to everyone. And at the end of the day, the benefit to our public health. So with that, I'm going to turn it over to Ms. LaTanya, and we'll go over Q&A, and we'll wrap it up.
Madam Mayor, our first question comes from WWO.
Yes, ma'am. I have 2 questions. First one is regarding the JP Chamber of Commerce letter asking for more communication between the city and other regional entities. What do you have to say to them?
Well, I think I've covered that. A way to communicate is not through the media, it's directly. And I welcome that. I know that I'm more than accessible and more than a team player as it relates to my partners. And that means thinking regionally, not just with our region, but throughout the state of Louisiana. But when I think about my parish presidents, around me, I know that we have a great relationship, and it will not only evolve, it will get even greater as we continue to work together. So working with leadership who has real authority is a top priority.
And the other question is, do you have any plans for the festivals, saints, conventions, about when we might see them again in the city?
My comment as it relates to, and I believe I was very clear about this, was 2020. And based on the data that we have, based on the forecasting of that data, and the well-being and health of this community, festivals and large gatherings need to be pushed away from 2020 and on look towards 2021.
All right, I have a couple of questions. The first one, there's obviously been a spike in crime over the past 2 weeks. Stay-at-home order is still in effect. What are your thoughts on this? And what can we attribute the spike in crime to?
Okay, well, there hasn't been a spike in crime. There's been various over the past weekend, really 2 weeks. You did say that. We have had some issues that we have been able to address pretty swiftly, but the New Orleans Police Department, for example, to have an even greater presence. The superintendent of police is moving forward with a deployment strategy that comes off the ground actually today. And so looking at deployment, looking very closely at areas where we have seen, that uptick, but also understanding that it's not random.
All right, what is the city's response to Unity call for you to do more to protect the homeless population, workers in area shelters, specifically the needs for more PPE in shelters, regular testing in shelters, and more temporary housing for homeless people?
Okay, as it relates to our shelters, city shelters, and our partner organizations, is that what you're saying? Well, testing is happening. They're in partnership with us every step of the way. As it relates to our homeless population, particularly, a real focus has been on street homeless. We have been able to occupy up to 3 different areas, particularly facilities, for street homeless, and with another hopefully to come off the ground this week. But we're not there yet. We still have people who are on the streets in the city of New Orleans that remain a priority for us. So it is a work in progress and continues to be one of those challenges that we're faced with, not only pre-COVID, but absolutely in the midst of COVID-19.
And lastly, your thoughts on business leaders asking for the city to reopen sooner than later?
Well, the city will reopen when the threat of public health isn't before us, and as it relates to COVID-19. And so we will continue to work through that process. As I mentioned, we will have a reopening committee structure that will be unveiled soon, that will speak to our process for reopening the city. And of course, that will be aligned with guidance at the federal level and state level. But we're not there yet. We're not there yet. So, as I mentioned previously, that we will not focus on a date. However, we will remain focused on the data that tells us the best time and the best way to open the city back up. It will be a phased approach. It would have to be. And so we're preparing ourselves for that. But I understand people want to get back to normal. But you know what? It really will be a new normal in this environment.
When it comes to the data, what do you think you need to see in order to feel comfortable enough to reopen the city?
Well, first of all, is not seeing the level of cases, positive cases that we are continuing to see. My director, my doctor, actually, Dr. Vegno, can speak to this for sure. But what I do know is that we're looking at really 14 days that could possibly grow into 21 days of having a very minimal, either 0 to some number, low, very low number that we can gauge in order to reopen the city. We're not there yet, but we are looking at the data, at the trends, to be able to guide us in when we should make the best decisions for the city to reopen. And Dr. Beckner, anything to add?
Yeah, if you saw the guidelines that the White House put out, and there's others based on these, there's some very general public health signposts, what I call them. And as the mayor said, one of them is a period of time that might be 14 days, it might be longer than 14 days of minimal new cases. That is a critical marker. Another critical marker is ensuring that our hospital capacity remains robust in case there is another spike. And so ensuring that beds are available, ventilators are available, and PPE has a ready supply on hand. That's critical. Some other things that if you notice in those guidelines, and again, everyone is really wanting to do best practices, is having enough contact tracing so that every new case can be swiftly identified, the contacts identified, isolation of that individual to minimize rampant spread throughout the community. So those are a few. There are others, but those are very general guidelines. And as the mayor said, we're going to do this regionally. We're going to do this based on what our trends are. There's not going to be a magic number at which a switch gets flipped and we go to the next phase. But it is all going to be evidence-based and to maximize health and safety.
Hey, Mayor. The first question I wanted to ask is, I think the comment of yours that really shook up some business leaders was about the events being canceled for the rest of the year. I think the government that we know where that came from. I'm not sure you provided the specifics. So did you have specific information, for example, Jazz Festival and other organizations?
Absolutely.
That they did not want to hold those events?
Sure. So the issue is, one, having large scale events that will bring thousands of people together. And it is not right for the climate that we're in. And as we look at the data and the year 2020, especially being a destination city and one that holds festivals, we have to think about things that we would allow for 20, that if we did wrong and we regressed, how that would impact 2021. But specifically with conversations with Essence, with conversations with the Jazz Fest community, that's what happened. Absolutely. And it was the best decision to make.
They told you they were fine with it.
What I'm saying is, in collaboration and consultation with leadership of Essence and Jazz Fest, those events needed to be and would be canceled. And as it relates to French Quarter Festival. So these are events, even keeping in mind with this, particularly the ones that you're focusing on. Jazz Fest and Essence are festivals that will be held, right, sooner rather than later. Meaning, Jazz Fest, as you know, last week in April, first week in May, and of course Essence in July. Both postponing those events to the fall. Deeper into hurricane season. Again, see, I have to look at the whole. And so when you think about deeper into hurricane season, and you've heard from Homeland Security of it being a very active season, in the midst of the city having to plan to evacuate, should we have to, individuals that are already hospitalized, a medical facility lifted up that's at the convention center, a community that we already have to, one, evacuate again or shelter in place in the midst of an epidemic or pandemic. So these are things that I have to think about as being mayor of the city, and it's not driven by a dollar. It's driven by the public health of this community. And as it relates to where we are now and where we want to go as a city and being healthier and moving from this crisis into full recovery, and as healthcare professionals all over the country, and even the world for that matter, speak to these large gatherings this year is something that will take us back and not take us forward. So factoring in all of these points, festivals for the city of New Orleans, which are, again, Jazz Fest, Essence Festival, Voodoo, and the French Quarter Festival. Other large scale, I mean, I don't know what else to tell you.
allow me also, please, that you said that you are going to be driven by data and not dates. Right now, you have a plan in place that I think we're going to continue this current system until May 15th. How does that mean? So how do we square? You're saying we're not going to be driven by dates, and yet you do have a date in place.
Because you have to have benchmarks. And just as the dates of the previous proclamation was a benchmark, and you measure the impact, the health of your community, and measuring that, you move it. So you have to have a benchmark in a timeline to work within to measure your effectiveness, to measure your impact, to measure your progress. So as we continue to measure our progress, that's aligned with the proclamation from the city of New Orleans and the state of Louisiana through the governor, we will assess and make changes accordingly. And that's how we're going.
So they won't be lifted before May 15th, or that's just an aspiration?
Right now, it's in place through May 15th, as you know.